Good morning, everyone. Welcome to our webinar. We're very pleased to have you on board and have you here with us this morning. We are very keen to share the insights from our food and health monitor, which we prepared and which we shared actually a couple of weeks ago during our event. And this webinar is where we share our highlights of what we've learned. So we're very keen to share them with you today. I'm here today with my colleague Tris Verhulst, and she will also share some key learnings in 2 chapters. If we go and have a look back at the event, and perhaps you've seen our communication already. We've done some segmentation about health types and claims, etc. And we were pleased to have in our office about 50 people, all coming from the food and beverage industry. So coming from supermarkets, ingredients companies, and companies working in packaged food. And what came through the discussions was that we all need to be prepared for the new evolution of the new thinking of the health and how people are behaving, because the mental health and physical health is what we saw is actually coming much closer together. And the other thing is the GLP-1 revolution. So what we saw is also the increase of GLP-1, actually that started last year when we were in May in our first event of Taste of the Future, is that actually the GLP-1 came through quite important, and that's why we dedicated more time today also to focus on that and see how Dutch people are actually reacting to that. And the last point, trust in an AI-driven world. We can't ignore it. AI, how are people and consumers making choices in terms of food, but also brands, and how can you be prepared and communicate still in forms where AI is very much prevalent? How do you communicate your brand, and how do people look for healthy food options? So it's really essential to use information, to listen to consumers, put them into your heart of the communication, and to support your brand and communication. So what we've done, we merged insights from various sources. So we have a lot of Ipsos sources. So they're coming from white papers, from global trends, and often they are coming from different parts of the world, and there's not often a Dutch equivalent of it. So we developed our own survey, which is called the Food and Health Study, which consists of 2 parts, actually. It consists of the classic survey, where we interviewed in a relatively short questionnaire 750 males and females, which also included a chatbot, where we delved into further details to understand more nuances on certain answers, followed by a qual at scale. And we interviewed 28 real consumers and 24 real healthcare professionals. And these healthcare professionals were all interviewed through this AI bot. So it was really interesting to see the richness of these interviews. They are all recorded. So in this presentation, unfortunately, I can't share the videos because people stayed anonymous, but we're very happy to share the quotes coming from it. And of course, our storyline is much more around the insights which were coming from these interviews. So what are we going to share today? Well, today we have 3 parts, and one of them is blurring the lines between physical and mental health, followed by medicalization, so more the GLP-1 part and what it means, and closing with navigating through this complexity of today. So I'm going to hand over to my colleague Tris. She's going to share more about the blurring lines between physical and mental health.
Yes, I will be talking about mainly the results from our Food and Health Monitor, but we have also integrated some of our global trend research to give you the more global context. So starting with the gap between the importance of physical and mental health. Globally, we see that it's reducing enormously. We do Ipsos Global Trends every couple of years, and here we see that people indicate that they need to do more to look after themselves physically versus mentally. We see that the gap between the two is getting smaller and smaller. Physical health is important, or physical well-being is important quite consistently, but the mental health has increased strongly over time, making the gap between the two very small. Now, what we now did in our Dutch study is we looked at what do people find important for their overall health. And then we also see that the Dutch very much focus on mental health. So 93% indicate that mental health is important for their overall health. Of course, closely followed by sleep balance and very closely by good nutrition. So it's definitely also about the physical health, and food plays an important role, but mental health is really at the top of the list. Like Lisa said, we also have our chatbot. So we asked open questions, and our AI chatbot further dove into the answers and asked follow-up questions. And there we also see that the exercising, eating healthy is very much related to the feeling mentally better. So you really see those elements coming back spontaneously in people's own answers. We also had a look at what do people avoid in order to stay healthy. And then we see, not so surprisingly, that no or less smoking comes at the top, but it's quite closely followed by no or less alcohol, with 51% of the people in Holland indicating that they drink less or no alcohol for health reasons. In the third spot, we see that people are limiting their phone and social media usage in order to feel healthier. Overall, that's 20%, but among younger people, it is already 32%. So that's quite a striking insight, in our opinion. Okay, this is what people avoid. Now let's have a look. What kind of characteristics do people look like when they look for food? And there we see that freshness is very important in shaping a healthy perception. Followed by filled with vitamins and minerals, a lot of fibers. And then on the fourth position, you can see that people look for non-processed foods or no artificial additives. Now, it's quite hard to understand what do people mean when we talk about unprocessed food. We didn't ask it directly, but we did do a correlation analysis to see with what other characteristics is it tied closely. And then we see that it's closely tied to local production, organic, fresh, and sustainable. But we also know not everyone is the same, right? People have different ways of dealing with health and using food in order to feel healthy. So what we did on a global level, so Ipsos Global built a health segmentation to understand what are the differences between people in how they deal with health and which role does food play in that. And we found 5 segments. So also in our study, we included this segmentation to see how does it look like in Holland. The first segment that we have is the health denialists, which is 9% globally and it's 16% in the Netherlands. And these are really people for whom they don't really worry about their health. They just want to feel good with the minimum effort. So it's not a huge topic on their mind. Then we have the happy hearts, for whom they care about health, but in many occasions, especially social occasions, they'll feel like, but right now I can make an exception. So when they're in with their friends, they will drink that glass of wine, even though they know it's maybe not that healthy. This group is globally 16% and in the Netherlands, 23%. Then we have the risk minimizers. These are people for whom health is not top of mind, but they want to be healthy, but they mainly do it by avoiding certain things. So by less smoking, less drinking, or not by actively doing other things to increase their health, but by avoiding things. And this group is 31% globally and 30% in the Netherlands. Then we have The busy balancers, for them, health is important. They really care for their health. They want to take action, but they notice that their life is often too busy to make it all work. This globally is 27%, and in the Netherlands, it's only 17%. And then we have the last group, which is the fitness enthusiasts. And for them, health is very high on the priority list, and they really try to take a lot of action to make it better by going to the gym, by doing sports, or by eating extra proteins, really focusing on eating healthy food. So this group in globally is 17%, and in the Netherlands, 14%. Now we have a lot more information in our food monitoring report, where we dive into all the differences between these segments. I will show you one of the statements and indicate how they differ, but in our full report, you can find a lot more details. But when we look at how do these people think about following the Schijf van Vijf guidelines, then we see immediately that there are quite some distinctions with the fitness enthusiasts, the busy balancers, and the risk minimizers, more or less quite strongly agreeing with it, while the happy hearts and the health denialists don't really follow the Schijf van Vijf. Now I'll hand over the floor again to Lisette to talk about medicalization.
Yes, so in this chapter, we focus a little bit more on obesity in the Netherlands, what it means and what it does and how people feel about it, and also about the GLP-1 awareness and consideration, and what kind of learnings we can have from the US and also the UK, and what kind of impact it has on our food industry. So when we look in what we see in the Netherlands, and perhaps this is not new to you, is that more than half of the Dutch adults are overweight and obese. So this is a really large group of our population. And actually, when we look at the data over time, this is gradually growing. And when we look at the data from reports we finalized during around Obesity Day, a couple of weeks back, 2 out of 3 in the Netherlands think there will be more obese people in the Netherlands in 10 years' time. So it's indeed, if we look in the future, people think it's also indeed growing. So also the consumers, not just the specialist in that matter. And also what we see is Dutch are considering being overweight as a major problem for the society as a whole. So when we think about those Dutch people who are saying, okay, I'm actually overweight or maybe even obese, we see that half of in our sample, the Dutch people want to lose weight, and 1 in 5 is actually taking actions to work on that, to really lose weight. So it's a large proportion who's actually wanting to lose weight and taking some action, or thinking at least about it. And only a third about the people in Netherlands are happy with the weight and want to maintain it. So it's really a growing problem in the Netherlands. And when we asked in our qual survey, so when we ask consumers in our qual at scale survey to think about who owns this or who was responsible for this, it's what we see from consumers coming through, and this is something you see from the quote, is it's your own choice and you put the things in your mouth yourself. So whatever you find in the supermarkets, it's basically you was considering those foods. It's your personal responsibility. And this is something which has been substantiated in our quant results. So 79% is actually personal responsible for their own weight and lifestyle. After this, so after your own responsibility, it's also the government who plays an important role. So there, of course, initiatives by the government to reduce certain things, so like the sugar tax, for example, but it's certainly important that the government is rolling out these types of initiatives. But when it comes to money, people are not really happy that it should, cost a lot. So it shouldn't come from our taxpayers' money to reduce obesity. Okay. Um, and when we asked in the call research, so both the HCPs who we interviewed and the consumers about their own responsibility, it's also the responsibility and the health responsibility from the food industry and the supermarkets. It's when we enter the supermarket with all these nice packagings, it's really attractive. People are really attracted to nice packaging, for example, but we also want the food industry to take their actions and have a fairer communication in terms of what is good for them, what's on their label, and to make that a healthy choice more easily. It's really the fundament of change people are looking for also from a supermarket to think about and from the food industry. So if you look at the packaging, for example, on the right from crisps, so also salt, for example, is one of the things people try to avoid is that the pack on the left, although it says on the big on the front pack without salt, also upfront is doing their utmost best to be transparent, be clear in terms of what's in the pack by sharing the ingredients, also the salt and sugar intake on the front. Although the upfront crisp might not be containing no salt, at least they do and try to educate consumers on that. So fairer communication, clearer labeling is really helping consumers to choose healthy. Okay, if you look on the next in terms of what people want, and 8 out of 10 of those who want to lose weight are very familiar with weight loss medication, and that's actually a really high number. So of those people who want to lose weight, they're very familiar with it. They are aware. When we asked about the awareness of certain brands of GLP-1, spontaneously, Ozempic is mentioned a lot. So 1 out of 3 can actually spontaneously mention Ozempic, which is a really high number if you only consider that Ozempic is on the market relatively short time for the general public. I think every brand wants to have such a high spontaneous awareness number. But if we also think about the people who actively trying to lose weight, 5% is actually using GLP-1 and 5% is considering weight loss medication. So it's a growing number. But if you look at the opportunities, people are still concerned about the long-term effects of weight loss medication. And that's something there's a role to play to share more about the downside effects perhaps of GLP-1. We have some interesting consumer quotes again to share. Unfortunately, I couldn't share the video, but this is a really nice quote from one of the consumers we interviewed. And they recognize it's a really easy way for people to lose weight in a very short time, but people are worried about the long-term effects, and it feels like a crash diet. You can lose a lot of kilograms, but actually without any programs to being educated about your lifestyle changes, you fall back into the same pattern. So currently it's seen as a very much quick fix, and maybe with some unrealistic expectations. Also, we interviewed HCPs, and they have seen an increase in the past year from patients or consumers asking questions about GLP-1, how they can, whether they can receive it. They're asking for consult. And it's driven by a lot of celebrities talking about it, and also media influencers and online information. So they're keen to even talk to the HCP about it and really understand the adverse effects. And that's something they go proactively to their doctors asking about the effects of GLP-1 in their diets. When we see about the GLP-1, what we notice from our colleagues and our conversations we have with our global clients, it really disrupts many industries. So not only the fast-moving consumer groups thinking about their how they can change their diets, for example, but also restaurants, for example, so smaller portions, more protein. It's quietly changing chain restaurant menus. So even in US and the UK, you see a lot of change happening there, but also in the Netherlands. So you will see two pictures on the right. I live very closely to the office, only 10 minutes bicycle ride, and I already discovered two posters on my way to the office. So about using GLP-1 or communication about it. So it's really also in the Dutch high streets to approach normal consumers about weight loss. What we see is that the users are actually buying less food and also fewer indulgent snacks. So it's changing their habits, changing their patterns. Consumers are seeing new types of products, for example, also in supermarkets in the UK. So Morrison was the first supermarket in the UK who launched a GLP-1 type of with more fibers, more protein in the UK, but more supermarkets has now developed their own private label menus to that to allow for people who are on GLP-1 diets. So as you can imagine, not sure whether you're working on in FMCG on ingredient company, but it asks for new adoptions in products, how you talk about it. And in GLP-1 friendly meals, asking for new claims. You see a lot of GLP-1 friendly. What does it mean? Is it clear? And how can you take consumers on that journey? How can you be clear for consumers and supporting them in making the right choices? So going back to the evolution of GLP-1, so around 10% is using it, considering it. When we look at the data retrieved from our US colleagues, we saw in the US that actually around last year, similar timings, in a year's time, it can actually grow up to 10, 15% even about usage. So I think we're on that same metric potentially in the Netherlands as well. Of course, it all depends on your own monies and see whether it fits your needs actually. But it might be that next year when we do the study again, we see an increase of this evolution in the Netherlands. Last but not least, the lessons we learned from our US colleagues on the impact on food and beverages. It's, of course, an increase on demand on GLP-1. So more doctors have been asked the questions about GLP-1, but it also means a pressure on healthcare, obesity in general. So more people are, obese. So the question about weight loss drugs is on the increase, but it depends on the coverage by our insurance, whether that's still possible in the long term. Followed by the third one. So cravings are different. So companies are offering reduced pack sizes, for example, for GLP-1 users. But also the types of food people are craving for or needing for to have a healthy diet. It's more on proteins and fibers, and also spending. So we can imagine that there is reduced spending on groceries and a different kind of spending. So perhaps more on the freshness, more on fruit and vegetables, which are actually more higher, more expensive items to buy in the supermarket. So there will be things happening in the food and beverage industry in both supermarkets and FMCG. So now I want to hand over back to Tris, who's going to share more about influencers and claims and labeling.
Yes. So as you can already hear from what we've been saying, there are a lot of things changing in the food industry. And we want to look in this last chapter a bit at how do you navigate this complexity as a brand. From our Ipsos Global Trends, we call this decade the uneasy decade, meaning it's a turbulent decade. It's not one crisis, but many. If you hear the news, if you look at what happened in the last year and a half, a lot of things are changing. A lot of things are happening, and they're not making our lives easier. One of the things we see very strongly is that there is a lot of fake news. Also, the Dutch population, 75% believes that fake news is the biggest threat to our democracy. But fake news, yeah, it's everywhere. It's hard to know what's true, what's not true. And that also impacts brand trust. We see that from our research that brand trust is under pressure, especially with young consumers. So it's important to look at how can you gain trust? What do people understand? What do people believe? So we'll dive into that a little bit. Then we, of course, have AI. AI is there, and the role of AI will probably only increase. We see that 41% of the Dutch population believes AI can have a positive impact on their world. But that also means people are trying it, are using it, are trying to find new solutions. And then the question is, how will this impact the way we do grocery shopping? And the last, which Lisette already discussed in more detail, is the impact of GLP-1. Of course, there's a lot happening, and it will most likely impact the food industry. Now, let's start with how do you, as a food brand, especially build trust. We've seen in the Food Monitor that people are looking for more healthy food, but how are they doing that? How are they making these choices? Well, a lot of people, of course, look at food labels, but often food labels are seen as a barrier to make healthy choices. So 40% indicate that they want to make healthy choices, but the labels are not making it easier for me. Also, only 18% of the Dutch population understands or indicates that the Nutri-Score really helps them to make more healthy choices. So what do people look them for when they're looking at packages, when they're looking at products? Well, what we see is that the young people are often focused on finding or looking for extra protein, with 24% of the young people indicating that, while the older population are more focused on locally produced products. So these are things that as a brand you can also play into, which upfront I think is doing quite well with putting the ingredients on the front for the young people. They all know it, they all care about what are all the ingredients that are in there. Now let's have a look at what are other ways that you could potentially build trust. Now, there are, of course, a lot of food and health influencers. We have culinary influencers, health and wellness influencers. Now there's also GLP-1 influencers. So influencers do play a big role in how people make choices. And it's a good way for a brand to build trust because it's someone that is not immediately related to your brand. So they could create more authenticity, which could create a community around your brand. But what we did in our study was to see, okay, do people still trust influencers? Do they use them? Do they trust them? Now, looking at the answers, then we see that 24% indicated that influencers influence my food choices. And that is when they talk about themselves. We also have a statement where we ask, do they influence other people's food choices? And then the percentage is much higher. So we expect that there is a bit of a bias in here, but at least 24% indicates that their own choices are influenced. But we also see that 70% worries about the impact of influencers on other people. And we see that 74% is convinced that influencers often spread misinformation. So even though influencers could be a good way to build a connection or a community around values of your brand, we do have to be very careful in which influencers we use and can we really build brand trust. Now then, let's have a look at the role of AI. Right now, most people will just do their grocery shopping themselves. They'll go to the supermarket, they'll order online, but it will be consumer initiated, which means they will make choices. They will look at brands, they will look at products, they will look at labels. But here, the brand can still play a role because brands consist or exist in people's minds as a network of associations. So they might see your logo and be triggered by an experience, an emotion, a story, which is great. but what is going to happen in the future if more and more grocery shopping will be done by agentic AI? Because agentic AI will more likely look for different connections, which are much less emotionally driven. It's important to understand how you as a brand can play a role in the world of agentic AI. But before we go there, let's have a look at what is the role of AI right now. So we asked what kind of information sources people use when it comes to food and health. Then we see, of course, more general sources like search engine, friends and families play a very big role. We also find a number of specialized sources like healthcare professionals, fooding centrum, nutrition experts. But we already see that 11% indicate that AI plays a role. AI tools like ChatGPT. And we also asked, how open are you to use AI meal advice? Now, there we see that 42% already indicate they're open to use AI meal advice, which is even higher with the young people. So the role of AI will also in the food industry and probably in groceries, or in grocery shopping soon play a bigger role. So how can you prepare for this? How do we prepare for this revolution as a brand? Now, we worked with a number of global experts and looked at different white papers. And then we see that there are a number of things that you can do as a brand. One thing is move from category to brand intent. Now, how it happens when there is an agentic AI making your or doing your groceries, it will be that consumers write a prompt. Now, the goal has to be that this becomes a need first prompt, that in the prompt, they will emphasize unique things that they're looking for. They're looking for values. And in an ideal world, these are unique values that match your brand. So that in the prompt, they refer to things that are important or that are recognizable for your own brand and not for other brands. But that also means you need to operationalize your brand truth. It means you need to show up in a very consistent way across communication, product, packaging, so that the brand identity and the values that your brand stand for, which are unique, are recognizable across all platforms, so that the agentic AI can see the connection. And when they see something in the prompt, they immediately connect it to your brand and decide to look for your brand instead of another brand. Thirdly, it could be very relevant to reevaluate success criteria. I think a lot of us are still monitoring click metrics, but maybe we can find ways to also monitor whether an agentic AI selects you as a brand in their shopping process. And last but not least, we do believe it's all about human connection, which is also what we do in our research. It's always AI moderated or AI driven, but in combination with real people. So in a world dominated by AI, we believe people will seek authentic connections. And it will be important as brands to also see, can I find connections or communities which are offline, which really can build an authentic connection with consumers.
Great, thank you. Yeah, some key takeaways, the lessons learned basically when we were diving into the data, talking to our colleagues, but also, of course, to the HCPs and the consumers. We came through these key takeaways. So first of all, there's a blurring line between mental health and physical health because they really become equally important. That's something we haven't seen before. And also what we see from the Dutch people is that they are using food to really improve their holistic health, whereby fresh food and unprocessed food play an important role in this spectrum. What we also saw in Ipsos global segmentation in terms of how people behave and what their attitudes are towards food and their health, we see that not everyone is the same. And I think it's really important to look through that lens and see how various generations, but also these segments are looking at it, because not everyone is using the same ideas to look at food as well. If we look at the second one, the medicalization of lifestyle, obesity is unfortunately on the increase. more people become overweight. Also in the Netherlands, it's increasing. And many more people are becoming familiar with weight loss medication. So not even people who are actively losing weight, but also those who are thinking about it. They are familiar with it. And that's impacting in the long terms because GLP-1, although it has some concern, it will becoming bigger. It will impact the industry if we look at the other countries. And people will have different diets, different ways of buying products and consuming them at different times or at different moments. So eating habits will change, and the way you as a company or as a brand will, how you will adapt and how you will be transparent to communicate about it is very important to think about. And last but not least, so how do we navigate within this complexity? So within these uncertain times with the world of fake news, how can we make sure that consumers can make the right choices, and how can they navigate, and how can we support as an industry to support healthier lifestyles? There are ways to, of course, do that and investigate also with authentic AI and influencers, because these authentic connections are really important. So where do you stand for as a brand, and how can we make sure that even when people are adopting new technologies, how do you become still as a brand important in the in search, but also in buying and developing these new patterns of adapting food and buying it. So what we can do to support you, of course, these are just some ideas, and maybe you think about some ideas yourself whilst going through this presentation. But after our event, we already workshopping some of the ideas, some of the trends we've seen, and some of the insights with our clients. So this is actually very interesting because what we heard back from our participants is this is the first time we see actually from the Dutch people, the Dutch consumer and the Dutch doctors, the insights coming back. So we can really support you with help if you were working on, for example, brand plans or strategic plans. Our segmentation can help with targeting. So we have a lot of information which you can cut through and see how we can support with your brand or with your company. And also communication strategies, especially the role of AI, of course, including in it, but also with clear labeling. Does it fit your brand? But also how can we, as an industry, can really support with making people making easier and healthier lifestyle choices. And last but not least, of course, innovation, the pipeline. So what's in your pipeline and how does it connect with certain consumers? Is it the healthy heart or the fitness enthusiasts you're going after? And how do you communicate specifically with these consumers? Is it really about the health button, or do we need to communicate in a different way so you can still be attracted to them? All of this information can be found in our study. Today we just showed the highlights. There was more shown in during our event, but we're very much happy to share more about the report. Of course, it's not for free, but if you sign up for this webinar, you're more than welcome to generate also the lower price. So please reach out to me, and I'm more than happy to share more about it. But there's more information on our website. You can use the link or the QR code to find out more. And again, more than happy to have a chat. Although we talk a lot about AI, I'm still a human. So don't hesitate to schedule a meeting with me, and I'm more than happy to talk more about it. Thank you. Thanks for listening.
Thank you.